Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 11 starts now.
A day of drama and protest at the state capitol. Tonight, Governor Whitmer issuing new executive orders extending the state of emergency herself amid the threat of a historic lawsuit. With Lansing likely headed to a legal fight over the governor's emergency powers, Michigan surpassing 41,000 cases with 3,789 lives lost to the virus. We're glad you're with us tonight for Local 4 News at 11. The governor tonight extending the state of emergency through May 28th. We do want to point out this is different than the stay-at-home order. That is still set to expire May 15th right now.
The governor maintains she has the power to extend her emergency powers without the legislature's approval. Tonight, the GOP-led legislature says it will sue her over the issue.
For now, all emergency declarations and orders remain in place until a judge can sort it all out. Mara McDonald live in Lansing. Mara, there seems to be a real regional conflict here over these orders.
Devin, you're right. You know, listening to one of the senators from the Upper Peninsula who said they're not suffering from COVID-19 up there. They are suffering from the economic wreckage this virus is doing to the economy. It is clear that there is a lot of frustration from communities outside of Metro Detroit over how this whole thing is being handled. Today's legislative session to decide whether to approve an extension of the governor's emergency declaration had hundreds of protesters, some armed, demanding an end to the stay-at-home order.
You know, I live in rural Michigan where there's no deaths. Why are we locked down?
It has not been a warm and fuzzy week in Lansing between the governor and the GOP-led legislature. There are 2 laws on the books regarding a governor's authority in an emergency, and now the legislature is suing her. At issue, can the governor continue emergency executive orders without approval from the legislature? She says yes, they say no.
We have all come to the realization that life is different and likely to remain different for some time. We've also learned that there is to be a balance between life on lockdown and life lived in the presence of COVID-19. We can no longer allow one person to make decisions for 10 million people.
We remain in a state of emergency. That is a fact. For anyone to declare mission accomplished means that they're turning a blind eye to the fact that over 600 people have died in the last 72 hours. Another 1,000 people were diagnosed as COVID-19 positive. That we've got sectors of our state that the numbers are continuing to climb that we are watching very closely. So everyone's entitled to their opinion. But I am not going to make decisions about our public health based on political games.
Back here live, the governor has been under increasing pressure to ease up on some of these restrictions, and she has. Golfing, boating, nurseries, landscaping, to name a few. But there is clearly frustration over the rapidity at which some of this is being done. We're live at the Capitol tonight. Mara McDonald, back to you.
Yeah. All right, Mara, we'll stay on it. Kim?
We will. Well, some nurses from Royal Oak Beaumont are speaking out about their working conditions tonight. They say there's a shortage of personal protection equipment that's forcing them to have to reuse masks and gowns, and that's why nurses are getting sick. Jason Colthorpe is live at Beaumont tonight. What's the hospital saying about this, Jason?
Simply, Kim, that these nurses are not in danger. But I've talked to 3 different nurses today. None of them wanted to be identified for fear of being fired. However, all of them did say they are scared to come to work, plain and simple, and there's not enough PPE. What they do have does not protect them.
Nothing is real. It's like being in a sci-fi movie.
That's how one nurse describes what it's like in Royal Oak Beaumont's COVID unit.
We're flying by the seat of our pants. And every day, every hour, every 2 hours, everything changes. What we can and can't do. It was awful. Complete chaos.
Chaos because she and others claim they don't have enough protective gear. Instead, they have to reuse things like masks and gowns.
And this is against everything that we were taught as nurses You know, with like TB, you always wear a different mask, you threw it away, it's, you know, just things like that.
That's a different nurse who says you could tell when the re-sterilized masks started failing because they'd fog up.
Everybody started getting sick. We had over 30 nurses off on my unit, and then with COVID, and then on 8th Center there was another 30, and a family birthing had 17 from floating around there with float them when they had enough first, and then they go back up there and work, which is, I don't feel was real proper. So I just felt unsafe as far as any kind of PPE and the education and what they were doing.
But Beaumont Health's chief nursing officer does not feel they are in danger on the job.
We have taken steps to ensure the safety of our staff. That's first and foremost. We have made sure that the PPE is available. Yes, we are re-sterilizing masks.
Quite simply, this nurse says being on the front lines does not feel like being a hero.
We're expendable. There's no lost feelings on losing a nurse's life.
Beaumont's chief nursing officer went on to say, yes, they are sterilizing and reusing masks, but that's because of a shortage at the national level that's been documented. And also, there are protocols in place. If a nurse needs a new mask, she asks for one and gets one. She also went on to say there are no words to express the gratitude they have for all of the healthcare workers who are fighting this pandemic here and everywhere else. Back to you.
Yeah, ditto that. Jason, help me understand, did these nurses also have COVID-19?
They did, and they are all eligible to go back to work. As they put it, and Beaumont confirmed, what's in place right now is once someone who's had COVID, an employee, is symptom-free for 72 hours, they're able to return back to work, which, keep in mind, can come within that 14-day period. It could be less than that, actually. But that also does fall within the national protocols.
Sure.
Kim?
Okay. Jason, thanks.
Wayne County is making some cuts to help balance a budget that has, as you might expect, been decimated by the pandemic. The county is going to lay off or furlough 227 employees. They'll also leave 606 open positions unfilled. The unpaid furloughs are going to last at least 90 days. It could be extended to 150 days if necessary. Furloughs allow employees to keep their health benefits. These moves, it's expected, will save $30 million, but the county is facing a projected $152 million deficit at present. 3 major airlines among the latest to mandate passengers wear masks while traveling. The new rules now for Delta, United, and JetBlue. Travelers for these airlines will need to start wearing masks on Monday. Flight attendants for those airlines are already wearing them. This move comes following increasing pressure from airline unions and lawmakers as well. Delta and JetBlue will make masks mandatory from the moment passengers check in until they're off the plane. American Airlines will require face coverings starting May 11th.
With cases on the decline in Detroit, today Mayor Mike Duggan is calling on the governor to start opening the hospitals back up to normal operations.
If we keep doing what we're doing, every day's conversation is going to be more and more about what we can restart. The one thing, though, that I'm really calling on the governor and our hospitals and our doctors to work on is opening up the rest of the medical system. Having 700 empty beds is something we never saw in this city in a normal year. And what is really concerning to me is I think the day-to-day health care of a lot of Detroiters is being neglected.
Detroit has been the hardest hit in the state, with 1,035 Detroiters killed by the virus.
Ford releasing their plan today to get workers back on the job. The new safety protocols include no-touch temperature scans, daily health surveys, new hand sanitation stations. Workers will be required to wear face masks. Some of them are going to be given face shields if there is no way for them to be 6 feet or more away from their coworkers. There will be more time between shifts to limit interaction between workers. Also, the cafeterias and the other common areas, those will be shut down. The UAW says talks with Ford continue. No date has been set for the plants to reopen.
All right, well, Ben, we're all looking forward to this weekend's forecast. Are we done with the rain, at least?
For the most part, yeah, Kim and Devin, we are done. Just a few sprinkles left on the east side, and as those are gone, we'll wake up with dry conditions in the morning. And then it's beautiful May, which is going to start here in less than an hour. Let's go to 4 Live Radar, and you can see just a couple of those sprinkles left as you look towards the city. And we didn't quite pick up the inch of rain that we were looking for here for the last couple days. In fact, you really got to go out to Owasso, Saginaw to see that 1 inch mark. It's generally been about a ½ inch or less. Some spots have picked up about 6/10 or 3/4, but this has been a fairly light 2-day event all in all. High temperatures tomorrow will make it into the mid 60s, possibly upper 60s, depending on where you're at. Good deal of late sunshine. Just don't freak out if you wake up with the clouds, because the sun is coming, and it will be here for much of the weekend too. Those are the best numbers in the 7-day forecast. And we'll take a longer look at that coming up in a few minutes.
All right,
Guys?
Ben. Tonight, a father arrested on Detroit's east side after allegedly kidnapping his 2 children and stealing their mother's car.
Police say the dad, who doesn't have custody, was visiting with the kids in Warren this morning and took them while their mother was in the shower. He crashed tonight after taking off when police spotted his car. Both children were in the car when he crashed, but they are going to be okay. Increased testing for coronavirus is one of the major factors to reopening both the state and country.
Dr. Frank McGeorge is going to join us with the challenges of testing and what is stopping us from getting a clearer picture of who's sick and who isn't. But coming up first, life-saving transplants put on hold, the devastating ripple effect the pandemic is having next.
Have fun getting fit without even leaving your house. Join me for some at-home exercises your whole family can try tomorrow morning for Fitness Friday at 6 a.m.
The stories that really keep me going are the ones that showcase the best of who we are as Detroiters. So many of you reached out to us asking how you can help. Well, one thing we can do is to make sure our frontline workers aren't saving lives on an empty stomach. It seems so simple, but it's so meaningful. That's why Food for Frontline is helping keep our essential workers fed and fighting for our communities. You can donate now at clickondetroit.com/frontline and stay with Local 4 for the moment.